Good evening, everyone. The secret of crisis management is not good versus bad, it's preventing the bad from getting worse. With this thought, myself, Ritika Chatterjee, College President of Games from Hamdard Institute of Medical Science and Research, Delhi, takes this opportunity to welcome you all and our guest speaker to the session on the three idiots of COVID-19 protection. As we all are gearing up to go back to our colleges, so it becomes all the more important for us as medical students to know the preventive measures and the correct way to do them. But since most of us are not aware of the basic things, therefore there was an urgent need to know these things through this webinar. So now I'd request my co-host Zainab to introduce our guest speaker.
Thank you, Ritika. Hello, everyone. I am Zainab Iman, College General Secretary for Games. I take this privilege of welcoming our guest speaker for the evening, Dr. Rumpa Saha, Professor of Microbiology, UCMS, Delhi. Ma'am has done her MBBS from CNMC and MD from PGI Chandigarh. She is the author of Microbiology Practice Manual, joint editor of Rational Use of Antimicrobials, Indian Perspective, associate editor of Journal of Gastrointestinal Infections, and has more than 80 publications in renowned scientific journals under her name. She is also the executive member of Indian Academy of Tropical Parasitology. Ma'am, it is an honor for us to have you with us today. I now request you to kindly take over.
Thank you so much, Zainab and Ritika, and for those kind words of introduction. Hello, everybody, all the students. I believe you are all students of medical college all over, those who are listening. I'm happy to be amongst you today and appraise you and share my thoughts and appraise you with the three idiots of COVID prevention. This story, dates back to exactly 1 year back, when the December sun rose over the Chinese horizon and the whole world woke up to a start to witness the COVID-19. Since then, the COVID-19 is going on, and till the time it was like March 11th when the World Health Organization declared it as a global pandemic. From that time onwards, the pandemic is continuing, and all of us, including all of you dear students, are going through this pandemic. It's a very new experience for all of us, and we are struggling through this pandemic. All of you are waiting to go back to your colleges, and I think it would be really nice to tell you and to appraise you that what you should do to prevent yourself from getting the infection. We all know that prevention is better than cure. So before waiting for the vaccine to come, when it is coming, how many people are going to get vaccine, how long it is lasting, the immunity, these are all unanswered and unknown questions at the moment. So we will still go through the well-known verse of prevention, which is better than cure. I'm sure you all believe in this. So let me take you through the next half an hour or so through the three idiots of COVID-19 prevention. Now, first, let me show you the timelines of COVID-19 prevention. The start of the case in globally, there was 33 lakhs cases as of May 1st, and in India 33,000. But now look at the scenario now. There are so many cases. Can you see? As of November 26th, this is the status. So what should we do? Why aren't the cases decreasing? And every time, if you see from May to June, June to July, July to September, October, November, and now December, cases are increasing at a very fast rate. So we have to take our responsibility in decreasing the number of cases by following what we call the preventive measures. So with this little introduction, I will take you through some of the important facts about COVID-19, hand hygiene, personal protective equipment. These two are the major ways to prevent ourselves from getting this infection, as well as safe distancing and how to discard the hazardous material like masks and personal protective equipments. Okay. So first, some of the very important facts about COVID-19. The SARS-CoV-19 coronavirus. This is the virus. Coronavirus 2, SARS-CoV-2 we call it. So why is it known as SARS-CoV-2? So this is because it is caused by the same coronavirus which has genetic resemblance to the SARS coronavirus which caused the SARS attack, SARS epidemic in 2003. So because of this genetic resemblance with the coronavirus, which was responsible for the severe acute respiratory syndrome in 2003, this virus has been named as SARS coronavirus 2. So it is a double-stranded, it is a single-stranded RNA virus. The size is 0.12 micron or 120 nanometers. Now, 0.1 micron, you can imagine how small it is. And these are transmitted to us through the respiratory droplets. So what is the difference between the virus size and the droplet? Now, the size of the respiratory droplets is 5 to 10 microns. Can you see the slides? Can you see the slides?
Ma'am, we can see the slides, but they're not changing along with the PPT.
Aren't they? Not changing?
No, ma'am.
Oh, just give me a second. Just give me a second.
Sure, ma'am, no problem.
Sorry for the technical glitch. It'll sort out in a few moments.
Meanwhile, we would like to tell you if any one of you has any queries regarding the topic or would like to ask something to ma'am personally, kindly put down your query in the YouTube chat box. We'll try to respond to it.
Uh, is my PPT visible? Is the slide
Yes, ma'am,
visible?
it's visible. Yes, ma'am, the slide is
Yes, ma'am,
visible
it's
now.
visible.
Change of slides are visible?
Yes, ma'am, they are visible now.
Okay. So this was the timeline that I was showing you earlier. So look at the number of cases which were there in May. 33 lakhs all over the world, whereas 33,000 in India. And look at it now, it has changed from May to June, it has increased to July, then September, October, and as of 26th November, what is the state? It is so many cases are there right now. So our aim is to stop the increase in number of cases so that the pandemic can gradually come to an halt. So what I'm going to take you through is some of the important facts about COVID-19 virus and the methods of prevention like hand hygiene, personal protective equipment, and discarding of the hazardous material. So SARS-CoV-2 virus, as I told you, this is the novel coronavirus, but which has genetic resemblance to the coronavirus, which was responsible for the SARS outbreak of 2003. And because of this genetic resemblance, now the virus is named as coronavirus 2, SARS coronavirus 2. So it is a single-stranded RNA virus of 0.1 micron in size or 120 nanometers, and it is transmitted through the respiratory droplets. Now, the size of the respiratory droplets are 5 to 10 microns. So how has it increased from 0.12 micron to 5 to 10 microns? So when it is inside our body and we are secreting or we are excreting the virus through our breath or cough or sneeze respiratory droplets, what happens? The virus gets coated with our body secretions. And once it gets coated, it increases in size to from 0.1 microns, it increases in size to 5 to 10 microns. So these are known as the respiratory droplets. Now these respiratory droplets, they have a limited air range of 1 to 1.5 meters. And within this range, they gradually fall to the ground due to gravity. So when they fall, the virus is released. And if it falls on any other surfaces, that becomes a source of contagion. So these respiratory droplets are transmitted from infected persons through their breathing. Uh, when they breathe, they sneeze, they cough, they speak, and whether or not they are symptomatic people or pre-symptomatic or asymptomatic. So they are deposited on the surface, and those sources of contagion, that is when we touch these surfaces, we carry them in our hands and we transmit it when we talk to other persons, we touch another object and other people are touching that object. So these become a source of contagion. So to avoid this contagion, we must put up barriers. So what are these barriers? The first thing is hand hygiene. So how do we maintain this hand hygiene? So hand hygiene refers to either hand washing with soap and water or sanitizing the hands with 70% ethyl alcohol. Remember, when we use a sanitizer, the sanitizer must contain at least 70% ethyl alcohol. It can be more than 70%, but not less than 70% to be effective. And the constituent should be ethyl alcohol. By no means it should be methyl alcohol. So whenever you buy a sanitizer, please check on this. Okay. Now, this is to demonstrate and tell you how to effectively wash our hand or perform hand hygiene so that the virus is removed from every part of our hand and the hand then ceases to be a source of infection. So we should remember this mnemonic, Suman K. What is Suman K? Whenever we washing our hands or we performing the hand hygiene steps, surrender yourself to Suman K. So what does that mean? In Suman K, the S stands for Sitha. That means we rub the palms of the hands together. See in the picture, we are rubbing the palms of the hand together. This is Sitha. That is S for Suman. Then U. The U for Suman stands for Ulta. That is, over the right hand, you put the left palm. And using the rubbing both the dorsum and the palm surface, especially taking care of the webs of the right hand. And then similarly, over the left hand, we put the palm of the dorsal, the right hand, and again rub, taking care of the webs. So this is the ulta. Then M of Suman stands for mutti. So on the left hand, we rub the mutti, the fist of the right hand. So this will take care of the knuckles and of the right hand. And similarly, we do it on the right hand, the left mutti or the fist on the right hand. So that is mutti, then rub together. And then we take care of the thumb. A is for angutha, that is the thumb. So left thumb is rubbed properly with the right hand and right thumb is rubbed properly with the left hand. So this is A of angutha. And then nakhun. Nakhun is on the left hand. We rub the fingertips of the right hand thoroughly. So all the nakhun part, the nails will be taken care of. Similarly, we do it on the other side also, the left on the right palm. Okay, the left nails on the right palm, that is N. Suman is taken care of, and the last part is the kalai or the wrist. Then we rub both the wrist properly with the other hand. So Suman K, if you remember Suman K, you will be performing all the steps of hand washing with soap and water or hand hygiene with 70% ethyl alcohol properly. Okay, so this is a very, very important part of your preventive measures. And then the 5 moments for hand hygiene. So what are the moments when we should perform hand hygiene? First is whenever we are going out and coming back. बाहर जाने के बाद वापस आने के बाद हाथ को अच्छा से hand hygiene और hand wash करना है. Whenever we touch any objects which are frequently touched by other people, we should hand wash or perform hand hygiene with sanitizer. Then where else should we do? Before touching a patient and after touching a patient. Then before any clean or aseptic procedure is done on a patient. Then after body exposure or body fluid exposure risk. So if your hand is exposed to the body fluids of the patient in any way, again hand hygiene has to be performed. And then after touching patient's surrounding. For example, if the patient is sitting on a chair, the arms of the chair, the back of the chair, or the rails of the bed, or the table near the bed, etc. Any objects which are touched by the patient. So because the patient's hands are not clean and they may be soiled with the patient's body fluids or secretions, so the doctor has to perform the hand hygiene. Otherwise, we should remember that anytime we are coming out from outside or we have gone and we bought certain vegetables or some milk or whatever, so those have to be washed and used, and our hands have to be thoroughly washed or sanitized. Okay, so that was one part of the preventive step. Now the next and the most important part is the personal protective equipment. In fact, this hand hygiene, we have been emphasizing on hand hygiene from a long time. And it's very sad to say that it took a pandemic to get people to inculcate the habit of hand hygiene. Anyway, better late than never. So let us at least follow all the steps of hand hygiene and hand washing. So the next is the PPE. PPE stands for the personal protective equipment. So the first of the personal protective equipment is the mask. Now, as these pictures are shown to you, you can see that this is the N95 mask. This is the mask which is commonly available in the market, which is known as a 3-ply surgical mask. And this is the cloth mask that is available. Now, these masks can arrest, the N95 can arrest up to 0.3 micron particle, 300 nanometers. But remember, although our virus is 0.12 nanometers, what we have to arrest is the respiratory droplets, which encloses the virus. So the respiratory droplets are 5 to 10 microns in size and will be easily trapped by this type of mask. The same thing goes for the 3-ply surgical mask. Now, why? And then we have the cloth mask also. Although it is not a very effective tool, but I will tell you, if cloth masks are made and used effectively, they can still also help. Now, first we'll take each one separately, coming to the 3-ply surgical mask. Now, why is it known as 3-ply? Because it contains 3 layers. 3 layers, okay? So this is the outer layer, then the inner layer, and the middle layer. Now, the outer layer is made of non-woven fabric, which is supposed to be hydrophobic in nature. That means it will not allow water to be absorbed. So hydrophobic in nature, this is very, very important. The outer layer will be hydrophobic in nature, made up of non-woven fabric. The inner layer is a high density filter layer, which is made by melt blowing process. And this happens to be the filter layer. This is the filter layer, the inner layer. Okay. And the innermost layer, that is the middle layer, was a high density filter layer, and the innermost layer, which is in contact with our skin. It is the skin friendly composite fiber. It is made up of that non-woven fabric, and it is the absorbent layer made up of soft absorbent material. And this is hydrophilic in nature. That means it will absorb all the moisture that is coming out from our nose and mouth, right? So this is the 3, that is why it is called a 3-ply surgical mask. Okay, now how to put on this mask? It is very, very important to know now which type of mask to be used and how to use it. Now here I'm showing you a picture of a 3-ply surgical mask which has strings to tie at the back, and just below this you have another similar mask, but it has the loops. Now I would tell you all not to use the mask with loops, because these loops are very loose. You know, the elastic of the loops are very loose and they do not fit snugly as it should fit, and hence the purpose of using the mask is lost. So please don't use yourself the 3-ply surgical mask with the loop. Use the mask which has the strings, 2 strings on the top, 2 strings at the bottom to tie. Okay, and please advise all your relatives, all your friends also not to use the mask with the loop. It may be easier, you know, immediately use the loop behind your ears, take it out, but the purpose is lost, the purpose of using the mask. So how to use the mask? It should cover, as you can see in this picture, right from the bridge of the nose, right from the bridge of the nose until the whole of the chin. So this is how it should be properly worn. Okay, now see, if you have all of you must have used this type of mask, knowingly, unknowingly, maybe you are not aware or nobody has told you how to use the mask correctly. Now if you see the mask, you will see that there is a green or a blue surface and another which is a whiter surface, right? Now the green, the dark blue or the dark green side of the mask is the fluid repellent layer. Okay, so that should be the outermost layer, right, worn on the outer side. Then you have the white layer. The white layer, this should be the inner layer. Okay, this should be the inner layer. Now this mask, 3-ply surgical mask, also has a nose pin. That means there is a pin, there is a rigid pin over the mask on one aspect, on one aspect. The whichever side has the nose pin, that will be on the top. Okay, the nose pin will be on the top, the dark blue or the green side will be on the outer side, and the white layer should be on the inner side. Now after you put it like this, you tie the outer strings first, that is the upper strings, you tie securely behind your head tightly, and then pull the mask down to cover completely your chin and tie it behind your neck. So it should be tied tightly. There should be no gaps at all, so that there is no leakage of air from any side, either from near your nose or from your near your chin. So this side there should be no leakage from here or from this aspect or from below the chin. Once it is protected like this, you are protected. So cover it. This is very, very important. Cover it from the bridge of the nose to fold of the chin. Now the next type of mask is the N95 mask. Now the all of you must have seen, this is the picture. N95, these are all N95 masks. Now N stands for non-oil. That means, why is it called N95? This N means that if there is no oil-based particles are present, then you can use this mask. That means it is non-oil resistant. Okay. So in the work environment, if there is non-oil-based particles are present, then you can use the mask. So in our atmosphere, we have these. We can conveniently use the N. Now, 95 stands for the 95% filtering efficacy. So, N95 stands for non-oil resistant, 90% filtering efficiency of the mask. Now, you have, other than N, you also have R. R stands for partially oil resistance, and P. P stands for purely oil resistance mask. Okay. So, and other than 95, you also have 97% efficacy, filtering efficiency. You have 100% filtering efficiency. But as it has been tested and seen that N95, that means the 95% filtering efficiency of a non-oil resistant mask is absolutely fine. And these are also known as the N95 respirators also, you can say. But here we have to remember one very important thing. Now, see here also I have made a tick over here. So these are the N95 masks which we should use. But N95 masks also come in these varieties with an outlet valve over here. This one, these are the outlet valves. We should not use these masks which have these outlet valves. Why? Because once you put on the mask, there should be done a fit testing is very, very critical component of the mask. Okay, so the N95 mask requires that the user seal check each time we put it on. That means there should be no leakage of air from either this aspect, or this aspect, or from below the chin. So that is why we use the mask. Now it fits snugly. So then once we have put on this mask, when we breathe, if you have an outlet valve over here, this valve type of N95, whenever we breathe, the air comes out through this valve. Okay. So if a person is infected, known infected, unknown infected, asymptomatic infected, all the virus will be shed and it will come into the atmosphere from this valve. So we should not use an N95 mask which has a valve like this. We should use a N95 mask which is without the valve. So strictly masks with valves are strictly prohibited, right? Neither you should use nor you should allow anybody else to use. Please tell your friends, tell your relatives that this is not to be used. Now, N95 efficiency is 95% and it can also arrest. But these N95 masks should be reserved for the healthcare workers working in the hospital premises, right? Taking care of COVID patients, attending to COVID patients, seeing COVID patients in the ICU, in the wards, everywhere. For the general public, 3-layer, 3-ply surgical mask is absolutely good enough. So we should not waste the resources and preserve these masks for those who are working, all the healthcare workers, not only the doctors, not only the nurses, the residents, but also those who are doing the cleaning, the sweeping, those who are washing those COVID clothes, the mattresses, the sheets, everything. So all the healthcare workers, reserve these masks for the healthcare workers. There shouldn't be shortage of these masks with the healthcare workers, and general public, students, and all other general public, everybody should use the 3-ply surgical mask with the tying facility, not the ones with the loop, right? So remember, when we are using the mask, the nose pin should be on the nose, not below like this, okay? Not below like this. The nose pin should not be below. Nose pin should be above. It should be tied properly, one on the top and the other below like this, and not interlacing like this, or shouldn't be hanging on the neck like this. Okay. And there should be no leakage of air, either be air should not go in and air should not come out from any of these spaces when the N95 mask is put on. Right. Now, many of you have seen N95 mask, right? But it also comes, as a, you may be not aware what kind of N95 masks should be the actual one. What happens, there are sold in the market fake N95 masks also. It will resemble this mask and it will be available in different colors, but all these factors which should be there for N95 mask is not there in a fake one. So how to identify? First of all, you will have the model number written, then the lot number written, and then the filter class, that is the N, P or R that I have told you. The filter class will be written, the filter efficiency level will be written. So like we have it over here, N95 written. Then the approval number will be written. The brand name or the registered trademark will also be available, and most important part, the NIOSH name. NIOSH stands for National Institute of Occupational Safety and Health. So they approve these N95 masks. So either their logo or the NIOSH will be written in capital letters like this over here. So this is how you will identify that yes, this is a real N95 mask, right? It is very important to check for all of these. Then you know it is a real N95 mask and not a fake one. A fake one will have none of these. Maybe it will have a nose pin, but it will not have any of these, or it may not have a nose pin also. And this N95 mask, it may have a loop. These are available with loops, and these loops are very tight, secure loops, unlike the ones which are available with the 3-ply surgical mask. So the lower loop is put on first behind your head, and then the upper loop, and it should fit tightly. And so the check test has to be done. Okay. Now, what is the idea of putting on this mask? Now, as this picture you see, both of them are, this person is infected, not wearing a mask. Neither the person close to him is wearing a mask. So what you can see, that transmission of the droplets are coming and this person is inhaling them and is getting the infection. If so, the infection rate is, transmission rate is very high. Whereas if the COVID person does not put the mask, but the recipient puts a mask, the infection rate is still high because it is coming and it can go in through any part. However, if the person affected puts on the mask, he still, and the secretions and the air droplets are coming out and the recipient doesn't wear, then also there is medium risk. If both are wearing and they are staying close together, less than 6 feet distance, then also the risk is there, but it is low. But if they maintain a 6 feet distance, both of them wear the mask properly, then the risk is very low. And of course, why we are telling people to stay indoors is that, see, now you don't have any risk at all. Okay, but it may not be feasible to stay indoors all the time. For whatever basic purposes you need to go out, you should at least have mask on and stay more than 6 feet distance away from any person, because you do not know the person next to you is infected or not. They may be asymptomatic spreaders, it may be asymptomatic carriers. Okay, so this is very important. The mask is put on and the distance, safe distance of 6 feet or 2 meters is maintained for keeping the transmission at a very low level. Okay, so COVID-19 is still spreading. Why? Because what we try to do is we try to think that these are my colleagues, so I can speak without the mask. These are my close friends, so I can speak without the mask. These are my relations, so I can speak without the mask. So these are the three major reasons why COVID-19 is spreading fast. So don't do the above three mistakes. Wear your mask properly so that you can save not only yourself, your family, the whole society. So This is not correct. As you can see over here, the nose is exposed, the chin is not covered, right? This again is also not correct. The tip of the nose, it covers only the tip of the nose, not till the bridge of the nose. And also the full chin is not covered. The same thing over here. Over here, see, it is just lying on the chin. Over here, this is also not correct. Again, it has not covered from the bridge of the nose to whole of the chin. So if you can see in this picture, it covers right from the bridge of the nose to the whole of the chin. So you should wear your mask up to the top of your nose and under your chin so that it covers the whole of your chin and the whole of the nose. Please remember, don't do these mistakes. Okay, don't wear the mask. Don't wait till somebody tells you to wear the mask. Keep the mask on. And respiratory hygiene, respiratory etiquettes, cough etiquettes. If you have to cough, keep the mask on. If by chance you are not wearing the mask and you have to cough or sneeze, then you should sneeze into your or cough into your elbow, right? And then if you need to open the mask for a water break or a snack break, something like this, then open the tie, hold the mask with the strings, open the above strings, then sip your water, and then have whatever you need to have, small snack break, and then put it back on, and then sanitize your hand again. Do not touch the outer surface of the mask, because the outer surface of the mask is the one which captures all the infected viruses. So if you touch the outer surface, you will have to immediately wash your hand or sanitize your hand. Okay. SARS-CoV-2 does not know that he is my friend and he is not a patient. So you should be alert, aware all the time. I would again request you avoid using the mask with these loops, but use the ones which have these tieable strings which can be tied tightly and you are protected. Now, a few words, a few lines about the homemade fabric mask. Most of you are using this. It should also be a 3-layer structure, with each layer providing a fixed purpose, right? So don't buy masks from here and there. These are not reliable homemade masks. You have to get it tailored from the tailor properly. There should be an innermost hydrophilic layer, that means water absorbing material it should be made up of. The outermost layer should be made up of hydrophobic material, and the middle layer, which will actually will retain the droplets, which will be shown to act as the filter layer. It should also be made up of a hydrophobic material. Okay, so and tell the tailor who is making these homemade masks, they should be putting the strings and not the elastic loops. Why? Because these homemade masks should be washed with soap and detergent, properly with soap and detergent, soap or detergent with hot water. So if you're washing with hot water, at least once in a day. If you're washing them with hot water, the elasticity of the elastic will gradually fail and it will become loose, and the purpose of the mask will be lost. And remember, do not share your mask with anybody else, even if you're wearing outside or homemade. Any mask, do not share. Of course, the efficiency of the home mask is not like the N95 or the 3-ply surgical mask. So I would advise you, if somebody comes to your door and you need to open the door, you take a key, or somebody's coming to give you vegetables or whatever for some purpose, then you use these homemade masks. But once you go out, please use a 3-ply surgical mask with tieable strings. Okay. Now, what are the other personal protective equipment other than the mask? You have the gown or the coverall. So it's like this. These are the gowns. You can have a gown like this, or you can have a gown separately, parts of the gown like this. Okay, you can see 2 different types of gown over here. Then this gown can either be made up of fiber or plastic. Now, if it is made up of fiber, it should be, why I colored it yellow, it should be discarded in the yellow bin. If it is made up of plastic, it should be discarded in the red bin. Similar to the mask, the 3-ply surgical mask or the N95 mask without valve, remember, it should be discarded into the yellow bin. Then you have the goggles or the face shield. The goggles and the face shield are made up of plastic, so it should go into the red bin. Then the gloves, they should also go into the red bin. Then you have the shoe cover and the head cover. You can get separate like this, head cover, shoe cover, and the gown like this, or you can have it into a one unit like this. Okay, so depending on whether it is a fiber made, which goes into the yellow bin, or the plastic one, which goes into the red bin. Okay. Now, the same goes for the shoe cover and the head cover. So, the plastic ones into the red, the fiber fabric ones, the fiber made up of those made up of fiber, it goes into the yellow bin. Now, what is the proper method of putting on these masks? Many of you may be working or may be required to work in the hospital environment, and you will be needing to don these PPEs. So what is the correct method of donning? Donning means putting on the personal protective equipment. What is the basic step? First, either you do your hand wash or hand rub, following the Suman K. Remember Suman K every time you do the hand wash or hand rub, and then sit comfortable on a chair and wear your footwear cover while in the sitting position. Okay, so the first is the foot cover, whether it is a separate foot cover or whether it is along with the gown. Sit and put on the foot cover. Once the foot cover is put on, and then you should sanitize your hand. Okay, then you put on your gown, the body gown or the coverall, put it on. Once that is done, then you put on the N95 mask. Now, why I'm specifically mentioning here N95, because donning is done in the hospital environment when you are attending to the patients or you are into the red zones of the hospital environment. Okay, you should be fully donned. Fully donned means then you will have the mask and then the headgear, then subsequently the eye goggle or the face shield to protect your eyes. So after this, again you will sanitize your hand and then put a double layer gloves. Okay, a double layer gloves. So after washing your hand or sanitizing your hand following the Suman K using 70% ethyl alcohol, you will put your foot cover and then you will again sanitize your hand, then wear the coverall or the body gown, followed by the N95 mask, then the headgear, followed by the eye goggle or face shield, sanitize again, and then put 2 layers of glove. This is donning. So after donning, you do whatever is required by you to do, and then when you leave the patient care area, you will be required to remove these PPE because now these have become infected. So how will you remove it? There is a particular method of removing. So that is known as doffing. That is known as doffing of PPE. So when you are doffing, first you will remove the outer gloves and dispose into the red bag. I told you have put on 2 layers of gloves. The outer gloves is the most infected part because you've touched patients or you may have intubated the patients, you have taken a sample, maybe. So whatever you have done, so the outer gloves is the most infected area. So first you will remove the outer glove and then dispose it into the red bag. The next step is the removal of the gown. So you will take your gown off, roll it inside out. This is a very, very important part. Roll it inside out. The inside is not infected. The outer part of the coverall of the gown is infected. Roll it inside out like this. Roll it. And then from above and below. Then either fold it into a roll or fold it from above and below so that the inner layer is only exposed and the outer layer of the coverall is not exposed at all, and then discard it either into yellow if it is made up of fiber or into the red bag if it is made up of plastic. The next step is removal of your eye goggles or face shield and disposing, because these are usually made of plastic, so you have to dispose it into the red bin. Now after this, you will again sanitize your hand. Okay, so after sanitizing your hand, you will remove your headgear if the headgear is separate from your coverall. If it is there with the coverall, you will remove it with the coverall. Okay, so the headgear, if it is separate, you will dispose it into the yellow bin. then your shoe cover, and again disposed into the yellow bin. Provided, remember, every time all infected material into the yellow bin if it is made up of fabric, but if it is made up of plastic, it goes into the red bin. Then removal of the N95 mask into the yellow bin. Again sanitize, but remember, when you're removing the N95 mask, once you're putting it on, you will first put the lower strings and then the upper. So during removal also, first remove the lower string, do not touch the outer surface of the mask. First remove the lower string and then the upper string. Holding it with the strings, you dispose it into the yellow bag. And last is the removal of the inner gloves. The inner glove and disposing it into the red bin, and then washing your, this time no sanitizing, this time is proper hand wash with soap and water. So these are the steps of doffing. I will just show you how to remove the gown. First, unfasten the tie, then peel the gown away from the neck and the shoulder. See, this is the inner part, this is the outer. The yellow outer part is the infected part, the gray inner part is the non-infected part. So turn it, the contaminated outside part, towards the inside. Fold. See, now here you can see it, that the inside out is there, and only the inside part is now being seen, and then it is being rolled into from above below, and then disposing it into the proper red or yellow bin. Now, what is this? This is not wanted. What may be dangerous for others is also dangerous for you. Remember this, do not create a scene like this. If you are, even if you are in a hurry, this should not take place. This is absolutely not wanted. Now, this is a YouTube link. You can take a click of this, where all the steps of donning and doffing have been shown properly by us, as well as collection of sample for COVID-19 patient, that is the nasal swab and the throat swab. So all this is given properly in this YouTube link video. Okay, so coming to the last part is the disposal of the biomedical waste. Now, most of you are already aware of this. We have the infected ones, as I was telling you, infected waste goes into the red bag if it is made up of plastic, like syringe, gloves, any plastic waste, etc. Then infected non-plastic, whatever is infected with the body fluids of the patient, but not made of plastic, made of fiber, then they all, and it is soiled with the infected waste, okay, and laboratory waste, they all go into the yellow bag. All glasswares into the blue bag, and all the sharps into the white bag. And the rest of the general waste, like kitchen waste, paper, tissues, water bottles, cans, etc., whatever is used by the patient, they go into the green bag. This is the further general waste. That means in COVID hospitals, all the COVID infected patients are eating there. They are being given disposable plates, spoons, and food. So whatever leftover food, they all go into the green bin. Now, there has been a slight modification in the general waste. There is a general green and a general blue. I will just tell you in a while. So remember that all bins should have a foot operated lid. That means it should be operable with the foot. And all bins should be double layered to ensure there is adequate strength and no leakage. And collection of bins which are used for COVID waste should be labeled as COVID-19. Okay, and they will be transported separately to the transporting system for the COVID waste. Okay. Now, as I was telling you, the red will have the infected plastic waste, the yellow will be infected waste other than plastic, blue is for glasswares, white is for sharps like needles and slides, etc. Sorry, the slides are the glasswares, they go into the blue. Sharps like needles go into the white. And then, as I was telling you, the general waste again has been divided into two. The general green will contain the biodegradable general waste, and the general blue will contain the non-biodegradable general waste. That means leftover food will go into the green, whereas the disposable plates, spoons, etc. will go into the general blue. So it will be written general blue, and they will contain all these non-biodegradable general waste. So that was for biomedical waste disposal. So now we come to the last part, the three idiots of COVID prevention. So by now you are all appraised what are the three idiots of COVID prevention. The first is the mask, whether it is N95 or it is a surgical mask, but it should be, if it is N95, it should be without the valve. And if it is a surgical mask, preferably use the one which can be with tie strings. Okay, so mask is the vaccine. The hand sanitizer or hand hygiene or hand washing with soap and water, or hand sanitization with at least 70% ethyl alcohol. This is your medicine. And lastly, a distance, safe distance of 2 meters or 6 feet. If you maintain the safe distance between any two person while talking, while doing any work, while whatever you are doing, just maintain this distance. This is your safe distance. This is your immunity. So our three idiots of COVID prevention is the mask, the hand hygiene, and maintaining the safe distance. I'm sure you must have now been appraised with the three idiots. Thank you very much. If you have any question, I would be happy to answer.
Thank you, ma'am. There are a few questions by our participants. We would request you to kindly answer to their queries. The first question says that since some of us will be using public transport like metro to commute to the college, are there any special precautions which should be followed? And also for the people who are going to stay in the hostel, what all precautions should they keep in mind?
Very good. This is really a very, very good question and a very pertinent question, I should say. Now, while commuting with public transport, whether metro or bus or something like this, now I have found out from those who are traveling in the metro, one seat is blocked in between two persons. Okay, so if you are in the metro, there is always a person at the gate of the metro who is not allowing the more than a specific number of persons into a metro train. Okay, so that there is no overcrowding, so that nobody can sit one after the other. So there will be a gap between every two person, or gap of one chair, where it is written that you cannot sit on that chair, right? You can keep your bag or something like that. So you maintain a distance between each person. One on the, you sit on the alternate chairs, and if you are standing, very few people are standing, so that there is no overcrowding. The same is there for bus. And when you are staying in the hostel, you should have to follow these three basic preventive measures. That means you will preferably stay in a room which is not shared by another person. And if you are staying in a room which is shared, maintain a distance. Try and wear your mask at all times, because you do not know what the other person. Don't say, this is my friend, I can talk to him or her without mask. So wear your mask, right? And maintain the distance. Frequently wash your hands, sanitize your hand. This is the best you can do, and this is a must that you should do, right? Anybody else has any queries?
Yes, ma'am. Rosa Iman wants to ask that is sanitizer as effective as soap water for washing hands, or they both are equally effective?
See, the best always is to wash with soap and water, but sometimes it may not be possible. You may not get water and soap, when you're outside or in between patients, sometimes like that. That is the time when you should use a sanitizer. When you are out of the house, everybody, whether you are a male person, whether you are a boy, whether you are a girl, you should carry a small sanitizer bottle in your pocket, in your purse, so that every time you accidentally touch, if you're standing in the metro and holding onto the railing, so once you get off the metro, you will immediately sanitize your hand with the sanitizer that you carry in your pocket. But to be effective, the sanitizer should and must contain at least 70% ethyl alcohol. Remember that. So whenever you're buying a sanitizer, please check and then buy. Anything else?
Yes, ma'am. Next question is by Shahzeeb Zaman. He asks, is it okay to reuse masks? If not, how frequently should we replace them?
Okay. Now, when you are using a disposable 3-ply surgical mask, you cannot reuse them. Once, if you are just going to take a water break or a snack break, you will just open the tieable strings from the top, remove it with the help of the strings only, and then have your sip of water or a biscuit or whatever snack you're having, tie it back, wash your hand or sanitize your hand. But once you have removed it, once you have gone out and come back in, you will remove and dispose it. There is no question of reuse. However, for the purpose of healthcare workers, if there is a crunch or a scarcity of N95 masks, because they cannot work without N95. Now, there is a method of reusing is, suppose I get 5 N95 masks in a month. So I will be given 5 N95 masks on day 1 of the month. Now I will need 5 envelopes also, and a pen where I will write 1, 2, 3, 4, 5 on the mask and my name on the mask. Similarly, 1, 2, 3, 4, 5 on the envelope and my name on the envelope. Day 1, I will use the N95 mask, and when I have done with it, I will open it and put it in envelope number 1, cover the envelope, and if I have to bring it home, I will leave it in one corner of the balcony or in a place, or hang it on the clothes lining in one corner, so that the sun can penetrate through it, or preferably leave it in the hospital. It will be taken care of. Okay, so if you have to bring it, leave it in one corner where it will not be touched by others. Then again, I will use a fresh N95 on day 2. When I finish, put it in the day 2 envelope and again keep it. Day 3, I will also use a fresh one and keep it. Now, at least for 72 hours, it should be kept before we can reuse it. So either for 72 hours, it should be kept in a paper envelope, not in a plastic. Remember, if it is a plastic envelope, the moisture will not be taken care of. It will remain and you cannot reuse it. Preferably should not be reused, but if there is a crunch, you can, this is the best possible thing. It should not be autoclaved, it should not be put in hot air oven, it should not be kept in open like that, and only after putting it into a paper envelope and then putting it either corner clothes lining or something like that, you can reuse it after 72 hours. But the 3-ply surgical mask should not be reused once opened, and the homemade face mask should be washed with hot water and soap at least once a day.
Ma'am, we have one more question.
Sure.
Tejasni Suman. Ma'am, she's asking that is there any benefit of the N99 mask for doctors in the current scenario over N95 masks?
Well, Suman, there is actually no benefit. So it is, if you have to use, if you are a healthcare worker, if you have to be posted into any place where you may be dealing with patients who may or may not be COVID-95 infected, it is always better to have to use the N95. If there is no other benefit, we use N99. 99 will stand for the 99% efficiency in removing, okay, filtering efficiency. N95, 95% efficiency is as good, and it has been stamped and it has been referred to by the NIOSH, as I have told you. So this is as good enough. But yes, even if you are using N95 or N99, please see all those things which have to be seen on the mask before you are using it.
Ma'am, one more question by a participant. She asked, since colleges have a very crowded environment, how do we manage during the lunch breaks? How do we eat and drink in a crowded environment?
Yes, you see, what colleges are basically trying to do right now is, once they have opened or are opening, they are calling students in batches, so that the whole batch of either 200 or 150 or 100 do not come all at the same time. So first thing, colleges are trying to call them in batches. So there will be a minimum number who will be attending one particular part of the college at one time. Maybe suppose you have a batch of 100 and say 25 will be attending one particular practical or something, 25 will be attending the other practical, another 25 the other practical, and the fourth 25 will be attending another practical, A, B, C, D practical simultaneously going on. The next day they will change. So either like that. So during lunchtime, what you are supposed to do is you are supposed to be either in a room or outside, preferably outside. If you are outside, that is the best. Sit in a place where you are at least 3-4 meters distance away from your friend. Okay, and then you open the mask, have your food instantly, cover your mask again. Okay, wash your hand, come to a place where you have to sit and eat, then open your mask, sanitize your hand with the sanitizer that you should keep, eat your stuff, put on your mask. There is at this time you should have to avoid sharing your food with your friends, because this is not going to help at all. So this you have to keep in mind, and your friends will not get cross with you. You explain to them, those who have not been listening, if you explain to them why they should not be, why you are not sharing with them. I'm really happy that students are coming out with their regular queries, and I'm really happy to answer them. So all doubt should be removed from your mind, and so that you can follow all the preventive measures. Anything else, Ritika, Zainab?
Yes, ma'am. We have a common question by both Abdija and Sayantika Ghosh, that do we need to wash N95 masks, because some they are now available in markets as washable N95. So do we need to wash them?
No, no, no. You will not buy there nothing. N95, I have told you how to reuse them in case it needs to be reused. There is nothing known as washable N95 mask. I told you there are fake N95 masks in the market. Like you get, many things fake coming up. So N95 fake so-called N95 masks are coming up. N95 masks are not washable at all. And an N95 mask cannot be worn more than usually 6 hours. What happens, all your moisture, if it gets wet before that, you have to change it. So if it is wet before that, you have to change it. There is no question of washing. If you have to reuse, I've just told you how to reuse it.
Ma'am, the last question by Suraj, who asks, which mask is best suitable for medical students?
Yes, I have just also told this, but I would definitely be happy to tell again that as a medical student, if you are not going into the patient care section or into the red zones of the hospital, it is always preferable to use a 3-ply surgical mask with strings which are to be tied properly, and you need not use an N95 mask. If you want to use, you can use. There is no, I cannot stop you from using, but I would prefer that it should be kept reserved for people who are, taking care of patients, who are in the patient care section, whether they are doctors, nurses, keepers, whoever it is, right? Or those who are into the red zones of the hospital. So that is the time when N95 is a must. I can tell you one thing: if you have to travel or commute in a metro and all, and you see that things are going out of hand, it's getting a little crowded or something like that, then preferably use an N95 mask, and you can reuse it the way I told you, or you can dispose and use a fresh one.
Ma'am, a few people also want to know, does layering of masks help? If we put 2 masks or 3 masks at once, does it help?
Well, if you put one mask properly, right? If you use the mask, 3-ply surgical mask with a nose pin and the strings which to be tied above your head and below your head properly. By proper, I have told you what I mean, right from the bridge of the nose to right from below the chin. If it covers all this area and there is no leakage from this side, this side, this side, then using one mask is as safe as using 2 or 3 or 4. You need not suffocate yourself using so many. If you want to change the mask and put a fresh one, right? So using one mask, but proper use of mask is good enough. And using 3 masks and using none of them properly is as bad as not using a single mask.
Ma'am, one last questions. There are a lot of questions coming,
No,
but
no, no.
since we
You
have a
go on.
time
I have no
limit,
problem at all.
last question we have from Gautam Garg. He's asking that for those who go to play sports in courts, what any special precaution do they have to take? Because they are in a crowded area, but they can't put masks because they are playing sports.
Gautam, I am not very clear of what you want to ask. If you have to go in a crowded area, you have to put on mask, or you have to avoid the crowded area if you can't put on a mask. You can, at this COVID pandemic, nothing is normal. The new normal is with the mask, with sanitization and the safe distance. If you cannot maintain this, but you still have to, pursue whatever you are pursuing, then you have to stop it temporarily. So if you are going to play tennis in a tennis court, wear a 3-ply surgical mask. If it gets wet because of your sweating, change it, but do not be without the mask. And if you have to play any sport which is in a crowded area where you cannot put on a mask, then you have to avoid playing that particular sport during this pandemic period. Right? I hope I'm clear to Gautam.
Ma'am, we have one more question by Shagun Ratwana, that while eating, do we just untie the upper strings and let the masks hang and then eat, or do we remove them completely?
Yes, this is again a very, very good question. Now, I would prefer that you keep a newspaper with you, right? Or you keep an paper envelope with you. So during this is during your proper lunch, not a snack or a water break or something like that. If you have to have a water break or a small biscuit snack, something like that, you can open the above string. Let just hold the string. Have your little bit of water or what a small snack break like that, and then put it on again and sanitize. But when you're having your lunch, please open the whole of your mask. Don't let it hang, because I told you the outer surface of the mask is infected. So if you're letting it hang on your clothes like this is not the right way. Open the whole thing, put it on your newspaper, which is kept beside you, or into the envelope. Okay, sanitize your hand, eat your quickly eat your lunch, then again take out the mask, put it on, or use a fresh mask and again sanitize or wash your hand. You cannot let it hang by your, by removing the one loop from this side and let it hang like this, or removing the upper strings and let it hang on your chin. The outer surface, which is infected, will touch your clothes, your other body parts, and it will infect that. So put it into an envelope, quickly sanitize your hand and finish your meal, put it back on, or use a anything else, Ritika, Zainab?
No, ma'am, thank you so much for answering all the queries. I now request Ritika to kindly propose the vote of thanks.
I'm really happy, that students have come up with questions, because whatever doubts are in their mind, they should always clear it. And I really hope I have been able to clear your doubts. All of you students who have been listening patiently for this long period, I am sincerely hoping that you will follow all the preventive measures and stay safe and healthy during this pandemic, and keep your family, friends, and everybody. Don't hesitate to correct anyone, whether it is your friend, your close friend, or whether it is a senior doctor or a senior from your senior sections, senior classes. Don't hesitate to correct any of them if they are not wearing the mask properly. Don't hesitate, even if they scream at you, shout at you, whatever they say, but please do correct them on the proper use of mask.
Um, At last, I would like to thank Dr. Rumpa ma'am on behalf of the entire James team for this extremely enriching webinar, for which she took out time from her very busy schedule. And thank you to all the participants for their patient hearing. Hope all of you had a mesmerizing experience and lot of take-home points today. Thank you.
A
Thank you
gentle
so much.
reminder. Thank you, ma'am. A gentle reminder for the participants to kindly make sure that you fill the post-sessional form to get your certificates and keep in touch with us. We will get back to you in a week or so.
So thank you very much, all the games team who have organized this, and I hope I've been able to reach out to all the students with the COVID prevention, three basic COVID prevention steps. And so with this, I wish you all a happy journey to the college, keeping yourself safe, and I take your leave. Thank you very much.